Today we're recording the podcast with Vasandra. Vasandra, she's a mother of a child and now adult with kidney disease. She became an organ donor. Also, she founded Kidney Warrior Foundation, and she's written a number of books about kidney disease and kidney management that help to support hundreds and hundreds of families that are suffering with this disease or supporting their loved ones. I'm really excited to have Vasandra on today's call. And hello, Vasandra, how are you doing?
Hi, Natalie. It's so nice to be here, talking to you, and sharing my experiences with so many people. I do hope it will help them. I'll try and talk a little slow because Indians tend to be very fast when we talk. So let me try to be a little slow.
Yeah. Excellent. Yeah, I think both of us can do the better job, just slowing down, because I believe today's conversation, we have a lot of valuable information for every person involved in kidney disease. So first of all, tell us about your relation to kidney disease, where you live, your background.
It all started when my son was 15 years old. He had this headache, which was not wanting to disappear. So we went to our family doctor, who was just a MBBS. And we just, she was very smart, Actually, she checked his blood pressure, and she said there's some problem. Because at 15 years, you don't need to have such high blood pressure. Then she called in her senior, and then we found out that his blood pressure is high, and we were advised to go and do a blood test. So we rushed across the street, got the blood test done, and then it was found that the creatinine was 4.58 mgdl, which was very high. So then we went to a nephrologist, and the nephrologist said, he was very patient. We saw that he was addressing a younger patient. So he was very concerned, and he said that, yes, there could be some problem with the kidney. And so I was so naive. So I just asked him that, does it mean that he'll need dialysis? And he said, yes, it could be there, but we have to do all the tests. And then the next few days, it was, the whole thing was like we were trying to do tests, find out what is wrong. And then when I told my husband that he's got a kidney failure, it was very shocking, because you don't expect a 15-year-old to have a kidney failure. So the first thing that happens is it just puts you into a big stop zone. You just think that now the life has come to an end, and you don't have any other thing to do, and there's no future for the child. So you start looking at things very differently. But fortunately for me, my husband was a very sensible person, and he's an engineer. So he started logically explaining how we should handle the whole thing, not get so scared, but start planning what to do next. So we went and met a few doctors, got a second opinion, and then we went back. My son was very keen that we went back to Dr. B.V. Gandhi, Bhupendra Gandhi, who was a very senior nephrologist in Bombay. So we went back to him, and we started treatment with blood pressure medications.
Mm-hmm. So just going back to that initial diagnosis, in age 15, you saw that your son was experiencing certain symptoms that you understood. What's the symptoms besides blood pressure he experienced? Was it tiredness, swallowing? What was kind of signs of early?
Actually, just start with blood pressure, and I didn't notice any thing like loss of appetite. I didn't notice anything, because I was so busy with trying to find out what next. Right. And I was the worried mother hen, jumping around, not knowing what to do, so scared that what would I do? How would I manage this? But my husband searched some information, and then gradually even I started looking those days in 1993 in India, the internet was very, we had a very archaic type of internet module where we could log in and check for a few minutes and then log out. We couldn't have a continuous flow of information. And I discovered that his bedwetting was one primary problem which we could have identified early and addressed it. So the problem was that when he was 10, we did go to a urologist, and the urologist advised us to wait for 4 or 5 years, and he said that he will be fine, not to worry. So that 4 or 5 years was the time when his kidneys had actually failed. So we had this. I faced this guilt that I didn't keep a continuous follow up. I didn't do a second. Didn't go for a second opinion, and that made me write this book, Shades of Life, about my son's disease.
So you basically your son was crushed into dialysis, right, to kidney failure, and all of your family were in shock. But then it was important to take a step back and start logically taking step by step, for understanding what's really happened, what are the causes, but then start looking forward and seeing how you take under control existing situation. So with that said, you mentioned that your husband took the leading role in the point of setting up that next steps, to set up some logic to get you back to the balance, so then you can manage your son care, and then you can know what to do and how to live the future. So that's certainly very challenging time for family and mother who deeply loving her child as well as father. It's very tragic. What did help you as a mother at that time from the shock and from the regrets and different feelings to go to the place of management and actually set your mind the way that you knew that now you're going to become caregiver and you will be able to be in control of your son's health?
So you see, my husband not only was logical, he also put all the gaps in front of us. He just said, okay, these are the loopholes. If you don't take your diet seriously, you'll have a very serious problem. So he made us so nervous. We got so worried. And then we started saying, okay, let us look at the diet. And the concept of diet has always been such a mystery, because in spite of getting all the expert advice, the doctors telling us that, okay, take a low protein diet, the concept of low protein was only a low portion of protein, but we needed to have a good value protein. Like, you get through eggs and through paneer, the cottage cheese and milk, but we were not given that advice. So we were trying to starve my 15-year-old, giving him less quantity. The less quantity, but good value protein is what is required. So that was a big gap in my understanding in 1993.
Right, and science was not necessary there, right? With a number of medical studies, they may not haven't yet understood the nutrition management as an important aspect of declining kidney, prolongs the function of declining kidney, and then of course in dialysis managing the other micronutrients that are so crucial to the survival rate and well-being of the patient.
That's right. So at that point of time, actually, through the years now, I'm seeing so much has changed in the field of kidney disease. And what was vesicoureteral reflux that my son had, today I have a group on Facebook for reflux kidney, and young moms from the US, they seem to know everything. And I'm just looking at them and I'm thinking, oh God, I didn't know anything. And these are so fully conversant with what is happening. They have the latest research in front of them. They are talking about it. So I'm so marveled seeing them, and I think that I need to keep improving my knowledge. So that's another way of looking at life, because that is a changing way. Science has grown so much, and technology has grown so much that we have very good scanning systems, good, ultrasound systems. So everything has developed so much today. So things are far easier, at least in identifying things properly, and doing biopsies and stuff like that.
Right. So it's been like 30 years, almost 30 years ago, right? The time when you faced with a diagnosis of your son, and going back to his story, he was diagnosed, and how long did it take him before dialysis, between the diagnosis and dialysis, and what was your care for him at that time?
Which is very, very funny because his was detected in November 1996, and by April he was finishing his school. He was in the last year of school, and March 96 he finished his final year of school. And April, by then we started, okay, now that his exams are over. As a mother, sometimes I played different roles as a mother. I was pushing him to complete his education. Come on, come on, let us finish school. You must not leave your education halfway, because it was so easy to say, okay, sit at home. Your health is more important. But I had to say, no, go and finish your school. So that role that I played then was I was like a monster mom. And
I'm sure it was the best intention, but sometimes when you may be reflecting and understanding how large the problem was, it was hard to realize at that time.
No, it was very important for us to see that he's finished his education. Because in our family, education was very important. We said, oh, education, we have to be educated. Because,
Absolutely.
With this disease, education is so important, employment is so important. People tend to take it very lightly, give up their jobs, give up their education. And then what happens? You need income to even manage your health. And at that time, you don't have anything to fall back on, and no one will help you with money. Money is not easy to come by. Education, if you don't take the education, you've lost your opportunity. So
Right.
that's how.
Yeah, so there are a number of aspects. It's interesting you mentioned this. We're actually now working on the new topic, disability and employment for ESRD patients, for end-stage renal disease patients. And we found very fascinating stats. Specifically in the United States, we have the highest amount of disability on dialysis, around 85, 87%, when in Europe, this number would be only 35%. In Japan, the number would be 10 to 12%. So there is a huge amount of people in the United States going on disability for a number of reasons. On one way is because maybe the process is allowing them to do that. In other parts, they may just have a worse condition because they have other comorbidity and underlying issues. And even having disability, for some patients, this may work for some time, but the quality of life and quality of care management, healthcare management, but also personal development, personal well-being seems also get compromised very often when patients isolated from the world for many and many years. So I'm really happy to hear that even in his very young age, being 15, 16 years old, he had the mindset that you taught him that education is the key. Disease cannot define you. You still have to be well-educated individuals and self-sufficient. That's probably that mindset helped him to fight kidney disease and achieve all the success that he has. So tell me more. So he was in the school, finishing his education, and when he finished the school, what was the next steps for him?
Next step was that we started evaluating who's going to donate. Mm-hmm. My husband was diabetic, and we knew right in March, in November, when my son was detected with kidney failure, we knew that my husband was not going to be able to donate. So I had got myself tested, and within few days, like the doctor approved me. He said, yes, the cross match is fine, and we can go ahead with the transplant and stuff like that. And he said, I would not recommend the preemptive transplant. I would like him to start his dialysis and then we do the transplant. So we were to wait for the transplant. In the meantime, within 2-3 days of being approved as a donor, I observed that I had a lump on my breast.
Oh no.
And I said, now what do I do? So my husband, by now we had become an expert in medical things, anything medical, we knew what to do. We knew the fix. So he said, just go to the doctor, get yourself tested. So I went to the most senior oncologist in Bombay. He's a gentleman who started the Tata Memorial Hospital. So I went to him and and he said that, yes, you need to go for a surgery. And then we have to see whether it's malignant or it's just a benign tumor. So the next course of action was getting myself treated. It was malignant, so I had to have a mastectomy, and then I had to go for a radiation, chemotherapy, then the radiation. And in the meantime, my son Aditya started his dialysis.
So much going on for your family at that time. So, like, a couple things happened, right? So he was finishing his school, and how did he feel about transplant? Was he scared receiving transplant? Was he very prepared? What was your son's state of readiness to start dialysis? Was he against dialysis? How did he feel, and what he was saying at that time?
So my husband, as I said, he had put us through this drill of he would sit with the boys. My elder son would be there, and my younger son, the Aditya, who's the patient, is the younger son. So he would sit with them and explain to them what will happen, how it will happen, what to look for. And so Aditya was prepared for everything. And when we went to meet his doctor, I took him to the dialysis room. I showed him around. I said, see, this is how it is. These are the machines. And there you have to get dialysis. You'll clean the blood. So I explained that to him, and then he was calm. He was not expressing emotionally what he went through. And I never found out, because I myself fell ill. So the whole thing was the constant, the attention was diverted totally to bring me back into good health. And so my elder son approached me. He said, I think since you have had cancer, I will donate my kidney. So we said, no, you please go and get yourself educated, because he was he was going into an engineering course. So we said, that is what is your future. You can't sacrifice your future. So he went in for education, and I got cured, and then I gave him my kidney. The doctor was very adamant. He refused to take my kidney. And I had to plead with him. I had to tell him there is no other way, because I would not allow my elder son to donate at that time, because they were just a year and a half apart in age. And that sacrifice was not required at that time. And so I got well. I made sure that I cured myself completely. And I pursued with the doctor that I should donate my kidney. So finally that happened in 1999. On June, I don't know, I forget the date. June 9th is the second transplant. And this was sometime in May.
Yeah, that's an incredible story. Just realizing how much you need to fight to give kidney to your son, right? And what I really admire, what you mentioned about your family, that your husband was a man who helped to set up boundaries, set up complete understanding of the disease, as well as scale of things, how they can grow if things wouldn't be proper managed. So it seems like you have a good guidance in terms of what is the next step, and the discipline and the mindset that you guys have to be 100% focused to treat your son as soon as possible and do the best thing. What you mentioned, that you, as a mother, even going through cancer and going and doing this treatment, it seems it was such a small thing that you really pay attention to, just because you had that mindset, donating a kidney and saving life of your child. So just kind of reflection, being a cancer patient, how did you deal with the fact of your diagnosis with the lump, going through the treatment? Was it difficult for you, or that mindset, saving your child, was really something that made you keep going and never look back?
Yes, one thing was, I immediately contacted, you see, in the same hospital I had both the doctors, my oncologist and the kidney doctor, the nephrologist. So I told the nephrologist, before my cancer treatment, let us remove the kidney and donate it. So he said, you'll be putting your son into a lot of risk, because you may transfer a cancerous cell. So he was very encouraging, and the oncologist, actually, he sat through a very good detailed evaluation and ensured that I think I put a lot of trust on my doctors, and they just did their jobs well. They just delivered to the court. They realized that I needed to donate, and I had no other option. There was no other family member who could have donated, and my son was not. The illegal trade of kidney transplant was there even in India even then, and my family was totally against it, because many people were sacrificed, because they were donating the kidney and they were not taken care of. So my family was totally against that. So we just had no other option but to donate my kidney. So I just worked on it. Like, it was one of those things when you work on a project, deadlines. So it was like working on a project deadline.
Yeah, it sounds like that you just have a very specific agenda, and you know that you have to fight, and cancer wouldn't define anything. It's just like a project that will be completed well, and you will accomplish your mission. How was that experience when you knew that cancer already cured and you can donate to your son? Did you tell him news? How was this news delivered?
Oh, it was not a news at all, because my doctor saw to it that every time I went for a test and gave him the result, he would never say it is okay. He would look at the report, mark something and give it to me, and I would say, okay, now what is this mark? Am I okay? Am I not okay? And finally, the last test done, I didn't know the last test was done, because every day I would come, there was a new homework, new test to be done. And finally, when I was so tired of these tests, because it meant that I was going to work and then going for this test, then running back, because I would leave the office during a particular hour to go for the test. Then I would run back to the office. I was very careful that I should not lose my job, that I should not lose my income. I should have everything in place. Nothing should happen which would disturb the peace in the family. So it was like we were on tightrope walking, where funds were available. We had to be sure nothing was wasted. So things were very tough on us those days. And so finally, the doctor told me that, okay, we can have the transplant next week, because the surgeon is going on a vacation. So he gave a date, and the transplant is on that date. So, it was like a big shock for us. We didn't know that it was happening.
So it happened overly sudden. So you went for the labs, and this time labs seems to be okay for doctor to tell you surgery happening in a couple days.
Yeah, it was like it was like, okay, my homework is done. I passed my exam. And
Seems like
it was very funny. But it meant that we had to organize ourselves very fast, where funds was required. And, in all the treatment that we had gone through, my son's dialysis, my cancer. So all the savings that we had all depleted. So we were without money, and we were in the hospital. And you see, there is something which is a miracle. And that miracle happened to us, because we were in the hospital and we didn't have funds. We had borrowed some money and got into the hospital. And suddenly it was like people were coming with money and helping us. Friends who came in, family members came in with money. So it was like, it was not planned. It's just that I said, okay, now I have to admit myself, and my son got myself admitted. And then rest, everything took place. It just fell into place. Nothing was planned, and nothing that we could actually expect. But then that is what is God's grace. And I am a very, very firm believer. I think nothing could have moved without him.
Yeah, that's really incredible. Just knowing that everything happened, even it seems to be so difficult and so complicated, especially considering aspects of financial situation in India and the way how insurance doesn't cover some of these procedures. So I assume at that time there were no health insurance that you can use, right? So that
No,
was
my husband had something in his company, but at the last moment, that the company policy was that they could not extend it for family. I don't know what happened. Something happened in the last moment, and then he was very tensed about not having the money, and that was his department, and my department was getting into the hospital. So I entered into the hospital happily, and I left it to him to find what is possible.
So tell me more, how was the motivation for you to move after being caregiver and organ donor to actually creating a movement for kidney patients and kidney warriors?
It became very important for me to understand that we were very specially um, appreciated by God, or what do you call it, gifted, or God was very kind to us to give us so many opportunities to make it possible for us to give a kidney, to find funds. And this was not only once. The second time, when my son was doing his PhD, was doing his doctorate in philosophy in the US. He was studying in the University of Southern California, and his kidney failed. The transplant kidney failed, and he went back into dialysis. The second transplant happened in the US, where he had a student insurance, and somehow everything happened very smoothly for him. So when we feel that there was a need for money, suddenly there was money. Like the insurance helped him to manage his transplant. And at that time he was an adult. So there was no way my husband and I could have interfered in his decision making. So we had to rely on him totally. And though we had by then managed to make some savings, but we could manage with the the school insurance. I felt that we have to do something for kidney patients in India, because we can't help them for a transplant, like pay so many millions of rupees to help a person to get a transplant. But we can help them in different ways. So that's how I started work on the Facebook. I opened this group, the Kidney Warriors. So I have about 1,800 patients from all across India. So you have people from the remote villages, remote cities, all of them discussing their problems. So we were able to counsel them and give them advice, but we were not able to help them financially.
Which is important first step for someone who have questions and they don't know where to go for resources. And disease itself is so overwhelming and stressful that no wonder people first of all looking for support and understanding that is it only happening to me, or are other people who suffering from similar disease, similar diagnosis. So I was wondering, in which stage usually patients come to your group? Is it kidney disease, or only kidney failure, or family members? Who are your members at Kidney Warrior?
We have caregivers. the mothers, we have the wife when the husband is a patient. And I find these caregivers, not many of them are able to really manage the patient. Because unless the patient is himself, he or she is there in the group and understands what is her problem, the caregiver cannot always be stepping into that into the shoes and help them, because many of them are so overwhelmed themselves. The patient is overwhelmed, the family member is overwhelmed, and there are too many aspects for people. There are so many things in life. A mother, if she is in the group, she finds the child is not listening to her, and and she's so unhappy that the child has got kidney failure. So the emotional problem of the caregiver also needs to be counseled. It's not counseling only for the patient, it's also for the family member. And not all of them are very brave or so smart enough to understand the disease and to pass on information properly to the patient. So that is where I find that is a very thin line, and I want to always cross. I keep telling the caregiver, please ask question, and I'm always particular that I message them privately and give them some information, so that there is, at least I'm doing my bit of transferring some knowledge. And whether that is taken positively and whether we save a life, it's not in our hands, because not much can be done. It has so many, the disease is very complicated, so it's not easy to actually do much about it. But we try to help, and conversations in the group help, because they keep talking about it. Someone talks about their experience, so people can learn from such things.
So you mentioned that having on your group variety of people who involve in patient care is very important to start the conversation. And having that support group, ability to ask questions, maybe to find additional resources. But as you mentioned that the disease management really comes with self-management and self-awareness of a patient themselves, unless they're child, and they are in charge of their decisions, in charge of their own education. So how do you advise patients who come on your platform and very motivated, but they may just have a lack of knowledge how to manage this disease and where to start? How do you have a specific program, or there is more like a conversation or one-on-one conversation with providers, healthcare professionals, or other patients?
In the group, we have also kept dietitians.
Excellent.
Dietitians, and we have also kept nephrologists. So you see, if someone has a report and says, can you tell me what to do now? So we are not doctors, we can't tell them too many things. But we have these doctors who step in and they answer their questions. And if it is something which the doctor feels that it is not to be answered by a third doctor, but the patient has to go back to his own doctor, then we always tell him that please check with your doctor. But the doctors are there, we patients are there, we advise each other, and we motivate them. Actually, many of them are doing very well. So, my day starts with happy birthday messages. So all these people are friends with me on Facebook. So I'll start with good morning, happy birthday to this one, that one. So, I know whether the patient is around. Sometimes I don't know whether the patient is alive or not there. Because on the Facebook, you can't make out whether who's alive, who's not there, what is happening. So we have such conversations like, how was your day? And did you have a transplant? If anyone had a transplant, please tell us how you're keeping. So these type of chats and posts are there. So we keep having conversation. Like, it's always asking opinion, asking. So, if one person says something, then sometimes you find that people who have been quiet and silent, they come and respond at that time. So it's a question of warming up to the topic. Initially, everyone is shocked. Everyone is going through that denial mode. It can't happen to me. It is something that happens to old people. It's not for young people. But today we have people who are very young, who are in the 20s, and they have kidney disease. So, it's a combination of lots of age groups are there in the group. So we are actually we've got lots of poll, and we are trying to find out, classify this information into different formats to find out more, and then we can be sharing it with people, with putting it up on our websites, giving it to our own governments, telling them this is what is happening in our group. We've understood patients and we've understood their problems, and we are now trying to share it with you, so you get some insights from what information we have gathered.